Hello, everyone. I am Dr. Debbie Hamilton, and I'm an integrative pediatrician, and I'm with the Neurological Health Foundation. And today we are interviewing Dr. Victoria Maizes. She is the executive director of the Andrew Weil Center for Integrative Medicine and a professor of medicine, family medicine, and public health at the University of Arizona. She's also the editor of the Oxford University textbook, Integrative Women's Health, and the author of Be Fruitful, the Essential Guide to Maximizing Fertility and Giving Birth to a Healthy Child. Welcome, Dr. Maizes. I will call you Victoria from now on. Thank you for joining us today.
I'm delighted. Thanks for inviting me.
So today we're going to go through a couple questions, really with the idea of today's target is to how to increase your odds of a healthy conception. So welcome. So in terms of healthy conception, how often are there problems with conception? So I guess we're talking about, are there infertility issues? How common is this?
Well, it's an interesting thing because people throw out about 15% of couples will have trouble with conception, but it's very dependent on age as well. And one of the things that's happened in our modern society is that couples are choosing to delay childbearing, and that absolutely affects your fertility, especially for women, but also for men, and importantly for men, it affects their ability to conceive a healthy child.
Okay, what ages are you talking about in terms of women and men?
Yeah, well, I mean, this is often surprising to people, but you're at your most fertile probably when you're in your late teens and in your 20s. Right. And there is some more challenge in conceiving once you hit 35, and then much more significantly at 40. And the reason that I think this is really important for women to know is that we have all of these headlines of celebrities having babies when they're 48 or 49 or 50. And I feel like the implied message is, take all the time you need for your career, to find the perfect partner, to have enough financial stability. And then if you should need some help, you could always have IVF, and look at all the people who've done that. But, the reality is that IVF, while it is absolutely miraculous, and, I think that Dr. Brown, who got the Nobel Prize in medicine for developing IVF, deserved it. It's only successful about 20% of the time after age 40.
Oh, that's good to know.
Like buying an insurance policy that only pays off 1/5 of the time. You sort of expect that your insurance policy is going to pay off every time and not just 20% of the time.
Wow. Okay. Well, it definitely sounds like age is a common problem with conception.
Yes.
What are the other problems that lead to
decreased
conception?
The other main problem for women is ovulatory infertility, and that can be a really wide range of problems. PCOS, which stands for polycystic ovarian syndrome, is a very common reason. And in that situation, women's hormones are a bit off, and their ability to regulate their blood sugar is a bit off. And right. So they may have a little facial hair, their periods may not be as regular as you'd expect. They sometimes have a slightly higher blood pressure, their blood lipid called the triglyceride may be a little elevated. So some of these things you might notice yourself, like if you go, why am I having all these hairs on my chin?
Right.
You'd have to go to the doctor to have measured to find out that they were a little off. But PCOS is relatively common in our country. Being overweight affects fertility, smoking cigarettes affects fertility, and other things along those lines. Endometriosis, I mean, there's a variety of things. Having your thyroid be abnormal, even, and this is one of the uncommon explanations for why people don't get pregnant, celiac disease. About 7% of women who don't conceive, when they're tested, they have celiac disease. And that's where you have an autoimmune disease where you can't tolerate wheat or gluten. And the good news is you go off gluten and suddenly you are able to conceive.
That's amazing. Now, are you seeing an increase in problems with conception? I know there's an increase in PCOS. We have more and more girls with that.
This is one of, again, the things that's a little hard to pick apart, because since women are delaying childbearing, it's hard to conceive. But there's other things that we think. We have an obesity crisis in our country, and it's harder to conceive if you're overweight. we have a lot of environmental toxins in our society. And
Yeah.
some of these environmental toxins are what we call endocrine disrupting chemicals. And what that means is that they alter the normal function of hormones, including the hormones that help you conceive. We live in a really stressful world, and
That's true.
can affect fertility. Because like from an evolutionary biology perspective, your body would get the message, now's the time to focus on survival. You know, reproduction is a luxury that you have when everything is in balance and healthy and not too stressful. But if you're just trying to survive, it's the wrong time to reproduce because it would affect your survival. And so your body tamps down your fertility.
Right, and that makes sense.
Yeah.
So if a couple is trying to get pregnant, what is kind of a normal time period for them to conceive?
Yes. So again, it's a little age dependent. First of all, we want people to know, are they having signs of normal fertility? So in women, that would be regular menstrual periods. And the length can vary. They could be regular at 27-day cycle. They could be regular at a 35-day cycle. There's not like a magic, everyone should have 28-day cycle like the birth control pill. It can vary, that's okay. But it's good to know that you ovulate 14 days before your period. So sometimes people think, oh, I'm most fertile when I ovulate, which is when an egg is released from the tube. And that's true. When do you ovulate? People have this idea, day 14, but they often count forward. And you actually have to count backwards, but you can't count backwards. So a regular cycle, you know, like if your cycle is 32 days, for example, then you'd subtract 14 from 32, and you'd with you that you'd ovulate around day 18. And that's when you want to have sexual intercourse. So some of the answer is, are you actually having sexual intercourse? Are you having it around the time of ovulation? And then if that's true, most women in their 20s and early 30s will conceive within 4 months.
4 months, okay.
Yeah. We tell women not to worry if they're under 35 for up to a year.
A year, wow.
If a year goes by and you don't conceive, then we say we should really do some evaluation to figure out why. But if you're over 35, we tell you to only wait 6 months. And that's because age is really a factor, and we want to help you in whatever ways we may need to help you sooner rather than later. And if you're over 40, we tell you to only try for 3 months. So even though it's harder to conceive as you're older, we don't want to waste time if we do need to get involved in some way.
Yeah, that makes a lot of sense. So what about many women are on the birth control pill?
Yes.
And obviously that is altering your hormones and having abnormal cycles. So do you need to wait a certain period, like in terms of before getting pregnant?
Yeah, you know, I would say that this is a very interesting question for integrative medicine doctors to discuss, because if you look at the conventional wisdom, there wouldn't be a recommendation to wait. There would be, you stop the pill, and then, you know, somewhere in the next weeks or maybe 2 to 3 months, you'll just start having normal cycles again. But we all know that sometimes women get pregnant on the pill, especially if you miss the pill, and certainly they get pregnant as soon as they go off the pill. So having said that, I believe in preparation. And I think that there's a period of preparation where you can eat a really healthy diet, and you can minimize any exposure to environmental toxins, and you can manage your stress. And so I like the idea of people going off the pill and doing all they can to kind of get themselves in order so that they can have a really healthy child. But that doesn't mean they might not conceive right away if they're not using other form of birth control.
Right, that makes sense. Yeah. Because I always said, like, a woman can actually take up to a year to really get her cycle back.
That is a possibility, but usually it's less. Now, the other interesting thing about the pill is that women are going on the pill when they're girls. You know, they go on when they're in their teens because they have irregular periods and they don't want to be surprised, or because they have acne.
But to say acne, a lot of girls, teenagers come to me.
Absolutely. And, you know, when you have a young woman who comes in and says, I want to go on this for my skin, and she's 13, you know, some part of your head is also thinking, and she won't have an unwanted pregnancy.
Preventative medicine.
Right, exactly. Then she may not know if she has PCOS. She may not
Right.
know if she has some underlying problem because she's been on the pill instead of recognizing that there's something amiss. And so being on the pill can actually mask the fact that there is something else going on. And I think that's some of why you don't see a return to normal periods, because there was never normal periods to begin with, actually.
Right. And you think about some women, if they're not going to conceive till they're 35, they've been on a birth control pill for like 20 years.
And
I mean,
that
that's obviously got effect.
I mean, you know, the birth control pill has some positives. Obviously, giving control of reproduction to women is a huge positive. Avoiding unintended pregnancy, which can be incredibly stressful and challenging in all sorts of ways. It helps reduce the risk of ovarian cancer, so that's positive.
Okay.
There is still a question, and it's unclear, but perhaps it does very slightly increase the risk of breast cancer. So that's what we know long term. But you have to acknowledge that the birth control pill is an endocrine disrupting chemical. Intentionally, it stops what would be a normal cycle. And so, you know, I do think that, you know, when people are younger and maybe not as, and this isn't to slam young people because some will be very conscientious, but you know, the way in which it might be a better tool when you're really young, and then maybe as you get a little older, there would be other birth control strategies that you would switch to. So I don't like the idea of someone being on it for 20 years. But I don't think we know that it's dangerous to be on it for a short amount of time, you know, for it's a great advance in medicine. And it has downsides. It also can increase the risk of depression in some women, and it can reduce libido. And you know,
that's interesting.
You might be happy about that, but you know, someone is 25 and married and has no libido and is wondering why. Think maybe it's the birth control pill.
Huh, that's interesting. Yeah, I wouldn't have thought about that. Okay, so what about? I also think about if you look at pregnancy timing, like more than one pregnancy, there is increased risk of having a child with more developmental needs if the pregnancies are close.
Correct.
So do you have any idea or recommendations about how to space pregnancies?
Well, what I've seen, and you're probably more of an expert on this than I am, is 2 years to reduce the risk of autism. That there is some suggestion that that would be what it would take. And again, you know, if you're thinking about a women's bodies and their health, pregnancy is taxing. You're essentially giving to this developing fetus and baby through breastfeeding your nourishment. You're preferentially giving them your omega-3 fatty acids out of your body, your calcium. You know, you're giving to your baby everything that it needs for its survival. So you do want a period of time where you replenish yourself. And so spacing pregnancy, I think, is a good idea.
Right. Because I also think it's not just pregnancy, but if you have pregnancy and then you're nursing, maybe even more calories just for nursing, but that's still taxing your body. So that could be 1 to 2 years, just that period.
Correct.
You know, so I feel like you're right. After, you know, I've had a couple kids and you really feel like you need to kind of regain your strength and you don't sleep. And I think that just makes logical sense. So since we're talking about increasing the odds of a healthy conception, what could a woman do in terms of increasing conception? Then the men are not off the hook. We'll talk about them later.
Yeah. So I think for women, there are many things they could do. And I did write a book about this. So just shameless plug. I wrote a book called Be Fruitful, The Essential Guide to Maximizing Fertility and Giving Birth to a Healthy Child. And it'll go in more detail than we can go in today about the foods to eat, how to manage stress, what supplements to take, how much exercise to do, what about your spiritual life? Should you ever use traditional Chinese medicine or Ayurveda? What are the roles for those kinds of things? And so that's in greater detail. But the reality is that as you're preparing to conceive, you want to be as healthy as possible to have a healthy child. And we don't live in a particularly healthy world.
Yes, I
So
agree with
what
that.
does your diet look like? There's really strong evidence from many large studies that are part of the Nurses' Health Study that
Mhm.
show that eating a Mediterranean style diet is associated with increased fertility. So your chances of having a baby are better, and that's a very healthy diet. We know it helps prevent heart disease and cancer and depression and Alzheimer's. So there's a lot of strong evidence to support that. So that's a diet that has more vegetables and fruits, legumes, fish, and we have to talk about which are the fish that are healthy.
Right.
It's
Yes.
lower mercury fish. It has some dairy, but the dairy is more as yogurt and cheeses and a little less as straight milk. It's lower in glycemic index, so that means you're not eating a lot of Captain Crunch or Cheerios. You're not eating cereals that bump up your blood sugar. You're eating
Right.
that are more whole grains and that are going to keep your sugars much more even. So those are some of the principles. There's also less meat in the Mediterranean diet, and that may be different for people. I really, really encourage people to eat organic at this point in their lives. I think that it's the best way we have of reducing the environmental toxins that we take in through food. And a lot of the toxins are actually rapidly eliminated from our body. Not all, but a lot. I also recommend avoiding plastic because the bisphenol A that's in plastic or in the lining of cans or in thermal receipts, within a few days you eliminate it, but we get exposed so much. So that's an environmental change you could make. You don't want to stand behind any idling buses. You don't want to get the pollution that's, again, in our environment.
Right.
There are vitamins. So for example, all of the major societies, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the American Academy of Family Physicians, and the United States the U.S., the United States Preventive Services Task Force, all recommend that women take folic acid. Some say a prenatal vitamin with folic acid. And that reduces the risk of having a child with autism, by association anyway. It reduces the risk of miscarriage, and it actually helps women conceive more easily. So there are supplements that are beneficial. You want to be sure you have iodine. So if you're a foodie and you only do Himalayan sea salt, you want iodized salt. So there's a lot of things that people can do that actually help them conceive, but also increase the odds of the baby being healthy.
Right. And in terms of things like prenatals, do you have a sense of how much before you tried for conception that you recommend?
Yeah, well, all those societies say it should be women of childbearing age. And the reason is in the United States, half of pregnancies are unplanned.
Unplanned, right.
So if you have an unplanned pregnancy and you weren't on a prenatal vitamin, then you won't find out weeks into the pregnancy and you've lost some of the chance to prevent a neural tube defect. And so, or to reduce the possibility of autism. So for sure, it would be good for all women to be taking folic acid and maybe a prenatal. So I like to really have this conversation with all of the women I see. But if you're just someone who's like, I want to take it right before, the 4 months before, because that's when the follicle starts to develop and the egg is slowly released. And interestingly enough, there is a benefit to men to taking a multivitamin. They don't want to take the prenatal because they don't need iron. So there would be an iron. Men would have a formulation without iron. But in men, spermatogenesis, which means making new sperm, takes about 4 months. So actually, it's about the same time period that you really, really want to be sure that men and women are taking a supplement.
That's great. Yeah, that makes a lot of sense. What about exercise? What's enough, but not too much?
Yeah,
that's kind of a balance.
Well, it's so interesting that you say the not too much because, I have to say as a doctor, most of my life, I'm trying to get people to do more.
Right, more exercise, right.
Someone tells me they run marathons, I think, good for you. How cool is that?
Yeah.
But not if they're trying to conceive.
Right.
This is the exception to the rule. The exception is that there can be a too much. So we know walking is great. If you walk every day for 30 minutes, that's great. Running, there's some evidence to suggest that vigorous exercise can actually interfere with conception unless you're overweight. If you're overweight, and that may be because people who are overweight have a little more of a PCOS kind of picture. And when they lose weight, they help regulate their blood sugars better. And so with the exception of overweight folks, you want to be doing moderate exercise and not vigorous exercise. So that means no spinning class, no marathon preparation, no Bikram yoga where you're in a room that's 100 degrees.
Right.
You only have to kind of back off and do mild to moderate exercise.
Right. Well, as I said, I live near Boulder, Colorado, and so what moderate and, exercise will probably be different than most people's idea of moderate exercise.
I think that's true. And, I don't automatically tell people don't exercise if they've been like a runner their whole life. But if they come in and they say they've had trouble conceiving, then I ask them to back off.
Yeah. What about other stress management or things like yoga, which I think are exercise, but also stress management?
Yeah. Well, as I said earlier, from the evolutionary biology perspective, if you're really stressed, your body has the message, wrong time to conceive. And in women and men, it'll tamp down the reproductive hormones. So it's really great. And this is something in my clinical practice, I always ask people, how do you manage stress? And sometimes they say, well, I watch TV.
Right.
Or I go shopping. And those are lovely activities, and they may be relaxing activities, but they don't actually tone the relaxing side of the nervous system. And so I like people to do something that tones the vagal nerve, the relaxing side of the nervous system. So that could be yoga, it could be Tai Chi, which are both active forms, movement forms of relaxation. It could be meditation. It could be guided imagery. It could be breath work. Some people do mindful walking, and that's okay. So there's a really wide range, but essentially you want to get into that zone, that relaxation zone. And there's lots of tools these days. There's free apps that I often
I have seen some of those.
I'll help you figure out how to do it.
Yeah, that's great. What about men? What do men need to know? You did mention they need their own kind of prenatal vitamin.
Yeah. Well, I think men are often left out of the picture. And of course, half of the genetics are coming from the dad. And so while age isn't as important a factor, and, I had one couple in my practice where the man was in his 80s and they had a baby together.
80s?
Yes, his wife was much younger, let's just say that. But
I imagine.
We know if you want to have a healthy child that after age 45, men have father children who have an increased risk of autism, of bipolar disease, of learning disabilities. And so it really is beneficial for men also to pay attention to age as a factor in their fertility. The diet that most men don't eat 5 servings of fruits and vegetables. Really want to include men in talking about that healthy Mediterranean style diet. And actually there have been studies that looked at in vitro fertilization, and there you're affecting every bit of the reproductive physiology, and still when the couple, the man and the woman, eats a Mediterranean style diet, they have a higher likelihood of conceiving using IVF. So diet is important.
Well, that's interesting.
Men make healthier sperm, which means larger numbers and also more normal sperm when they eat a Mediterranean style diet, when they eat more walnuts, when they take a vitamin that has zinc in it and antioxidant vitamins like vitamin A and E and C and the mineral selenium. So all of these things also affect male fertility. I worry in men about the electromagnetic field that they're carrying around. Men carry their cell phone in their pocket.
I was wondering about that.
It's right next to their genitals, and that affects the normalcy of the sperm. So get that cell phone further away. Don't carry it in your pocket anymore or on your belt. I worry about laptops on the lap. Hot dogs, marijuana. Marijuana has become legal in so many states, and it can be very useful in some situations, but not when you're trying to conceive a child because it affects the sperm. We don't actually know how it affects the eggs. Those are harder to study than sperm, but we actually know that it affects the sperm and creates fewer normal sperm.
Right. I mean, that makes a lot of sense.
For men.
What's that?
It's a lot of cleanup work for men too.
I'm about to say, the men aren't off the hook. People always like, oh, how does a woman get ready? But the man has to get ready too. It just makes sense.
And when people are being tested, men should be tested first, because it's very easy to do what's called a semen analysis on a man to be sure that the counts are high enough. You know, other than just, for example, a woman getting an ovulation kit to check and see if she's ovulating, the other tests on women are relatively invasive. So you first want to test the man with that very non-invasive test and be sure that he's producing sperm before you go down the line of lots and lots of testing on the woman.
Okay, that makes sense. What about any other toxins? I do worry about just the impact of EMFs on our, obviously impacting fertility, but also our children. I feel
Yeah.
like we're doing lots of experiments with our environment at the moment, but
Yeah, I think that's really true. And I'm just going to put in a plea that, you know, any moms listening, any doctors who take care of kids, you know, don't let them play with the cell phone. The cell phone's become a toy. And, you
yeah,
know, that's just having that. I think if you put it on airplane mode, it's okay, because then it doesn't have the frequencies coming in and out. With older kids, texting is way better than having it up against their head. Kids' skulls are not as dense, and so we know that that field is penetrating deeper into the brain and probably much more worrisome. They're still developing their nervous system. Again, that increases the risk. So it's something we really want to pay attention. But of course, EMF, electromagnetic field, is not the only risk. We talk about all the toxins in our food, in our water, in the products we use. So for example, how's your sunscreen?
right,
Shampoo, your moisturizer, your conditioner, hair gel, hopefully not hairspray,
right.
fragrances. They're making perfumes for kids now. Those fragrances, anything
Perfume,
that's an artificial fragrance, is an endocrine disrupting chemical unless it's an essential oil. And even those, lavender in little boys, will lead to the development of breasts, because, or breast buds at least, because it's an endocrine disrupting chemical. So there's a lot of work to be done, but it's doable. I mean, we can use stainless steel or glass instead of plastic. We
right,
can put a water filter system in our sinks or on a refrigerator that comes in the refrigerator and drink that water preferentially. We can do organic, and when organic is expensive, we can use what's called the Dirty Dozen and the Clean 15. And I want to put out a shout for the Environmental Working Group, which is a nonprofit that has tons of this information for free, really well vetted on their website. It's EWG.org, the Environmental Working Group. Great resource if you want to dive deeper and think about how to clean up your home or your children's lives or before you conceive.
right. Well, I very much agree with that, and I recommend that to patients. And the longer I'm in medicine, the more I'm really for organic foods. And you really start to see all the different ways we're exposed. But those are some great things. You think about your food, your water, you know, what you put on your body, how you clean your house. Those are the kind of things basically. But yeah, those are all, that's great recommendations. So do you have any other recommendations? Anything else that I haven't asked you or that you just think, you know, people need to hear?
Well, you've asked me a great set of questions. I also, because of the integrative background, like to ask people about their spiritual lives. There is this perspective that you could call the mystical perspective, which is that to create a human life takes male, female, and God, or you know, that other outside force that we have no control over. And we live in a religious nation, and lots of religions actually have prayers that help conception, have rituals. And so, you know, I like to ask people that, because sometimes when people are going through a challenging time, that's where their source of strength is. And
Right.
it's also the ways in which religious organizations offer social support and community. And so I think that can be useful as well. And then when people are struggling, if I were the healthcare czar of this country, which I'm not,
Yeah.
make traditional Chinese medicine and acupuncture available, because I think that that is a very different approach that can help nourish and replenish the system, and often can help people conceive when they've been having trouble. So I'd like people to know that, you know, say they've done all these things, and the power of the synergism of paying attention to your diet, your supplements, your stress management, the environmental toxins is really powerful. But sometimes you need a little extra help, and that extra help could be advanced reproductive technologies like IVF or something else along the way, Clomid, which induces ovulation, intrauterine insemination. There are other things, and they're wonderful, but a lower tech, less invasive first step, unless you're like 42 and you just got to do the invasive things super fast, I would say, is to think about traditional Chinese medicine.
Yeah, that's great. That's great. Yeah, I do know they help a lot with a lot of hormone management, stress management too. I think about
Exactly. Yes.
Well.
Yeah.
Well, that's great. I don't know if I have any other comments. You've been wonderful. Thank you so much for, joining me today. A lot of great information. I learned something. I always love learning things. So, and I think we have all the information. So thank you very much. And thank you everyone for listening today.
It's my pleasure. Thanks for interviewing me.
You're welcome. Bye-bye.
Bye-bye.